Hello, and welcome to Patient Care Skills, PTA 222 for the elbow and wrist. So again, I want you to review this video prior to your next class, and we will answer questions from this presentation at the very beginning of the class. We will also have presentations for the shoulder and scapula, and you will be returning in a note by, I think it's 6 o'clock that day. Check your Moodle for the exact time that it's due. At the end of the work day, basically. We'll answer questions for this video on the role of the PTA within patient care and telehealth visits. We will review case studies that are in this presentation. We will review them in class, and then we will get to the fun stuff, which is the lab for the elbow and wrist exercises and palpation. So before we get started on the lecture, I want you to think about who are the players on the patient care team that you know of, and what is your role as a PTA in this team. So pause the video for a moment and write down who you think are the professional players in the patient care team. So professionals that you could run into, and some of these you're not going to see so much in the outpatient setting, but you probably run into them in the inpatient or skilled nursing setting. So an audiologist is going to be working with the patient on their hearing. So if you see in the chart HOH, that means hard of hearing. That means your patient has an issue with their hearing. They may have a preferred side or a better side. So you want to find out, should I be standing on their left side when I'm communicating with them? If you see that there's a potential change in their hearing from what you deemed was their baseline ability when you first met them, and they have an audiologist, you might refer them, you might have them contact their audiologist to get their hearing checked, or have them go back and see their doctor. In the inpatient setting, you may also work with dietitians, or your patient may be working with a dietitian, especially if they have a new diagnosis like diabetes, or if they have some other diet-related issue, they may be seeing a dietitian. You're definitely going to be working with nurses in the inpatient and skilled nursing environments. So the nurse is definitely going to be an important player in this team. And so before you go into your inpatient treatment sessions, you're going to check with the nurse, and you're going to find out, is there some new stuff that I need to know before I get started? Are they scheduled for pain medication that I should know about? Maybe I can come back after the pain medicine has been administered. The nurse is also going to know things about when RT or respiratory therapy or speech therapy is going to come in. They might know when the occupational therapist is going to come in, and you could be coordinating your care with the occupational therapist. So in the hospital, oftentimes the OTs are treating the arm, the shoulder, the upper extremity, and fine motor skill, whereas physical therapy is working on more gross motor skills, transfers, gait, bed mobility. But we could be working together. So maybe we're working on standing balance while the OT is having them do, some kind of self-care, like brushing their teeth at the sink or washing their hands. And you could be co-treating in order to maximize the therapeutic outcomes of both of your treatments. You could be working together. The physician obviously is oftentimes the gatekeeper, determining when someone goes to physical therapy or gets physical therapy services. So they're definitely, an important participant in the healthcare team. A psychologist is, both physicians and psychologists have the capability of prescribing medication, and you need to know how those medications could affect your therapy. Does it cause dizziness? Does it cause fluctuations in blood pressure? Does it cause high blood pressure? Does it cause low blood pressure? Can it can it cause muscle pain? It's another fascinating thing to know about medicine is sometimes there is a side effect of muscle pain, which as a therapist can be quite frustrating to find out after you've been treating a patient for a while that the medicine they were taking was a contributor to their muscle pain complaints. A rehabilitation counselor may be involved. As in workman's comp, there may be rehab counselors, and there may be they may be seeing a different type of rehabilitation counselor for mental health conditions as well, besides the psychologist. A respiratory therapist is going to be vital to know about if you're working in a hospital setting and the patient is receiving respiratory therapy. Oftentimes, you can coordinate, again, your treatment to coincide with the optimum time after a respiratory therapy treatment. That opens up their lungs, their breathing, their airways. It allows them to have better O2 saturation, better breathing capabilities. You may be working on posture, which will then affect how functional and efficient their respiration is. So remember, if you slouch down and you have really bad posture, breathing becomes more laborious and less efficient. Versus having a nice open posture. So you may be kind of working with them as well on that. And lastly, speech and language pathologists. Oftentimes in a hospital setting, they're working on with a patient with regards to swallow deficits. So they may do a swallow study on the patient and put a big sign in their room that says, no liquids or solids. They may be like not being able to eat or drink at all, maybe getting IV or other means of nutrition. So if they have swallow precautions, you need to know, because if your patient asks you for a glass of water, you can't just hand them a glass of water because you risk them aspirating on the water on a thin liquid. They may have to have a thickener added to it. And at that case, you might, discuss or coordinate with either the speech pathologist or the nurse as to, you can let the nurse know, Mr. So-and-so is thirsty. What can we do? Is there something that you can do to provide him some relief from that? Your role as a PTA includes educating the patient about the disorder they're being treated for, their plan of care, and their interventions. You should be encouraging your patients to actively be involved in their treatment. You obviously will be providing selected interventions, and you will make observations of the patient and collect and record data. You also seek, understand, and accurately relay information to the primary PT. So that's your role. You may be relaying information to other healthcare professionals. You may be communicating and coordinating with other healthcare professionals in order for you to provide the interventions in the plan of care and in order to educate the patient about their plan of care. Okay, so for telehealth, ever since COVID overtook the world, we've been seeing more opportunities to provide telehealth. So this has actually been a really good thing for therapy and for patients, because it's a bummer that you can't get therapy when you're stuck at home because of a public health emergency, and it's hard to say when the COVID public health crisis is going to finally be over. And hopefully someday someone will listen to this lecture and go, "What are you talking about?" But I doubt that. Anyways, one of the instructors helped me put together a telehealth mock visit. We struggled quite a bit with getting the recording right, since when you record through Google Meets, whoever is talking is getting the camera time. I am going to provide the link to this recording in Moodle so you can watch the extended version. I don't think it's super necessary because I really want to just drive home a few important tips on how to best provide telehealth. So the things that you want to keep in mind, and this is from that other instructor who works with Concentra. This is what these are the things that they provide for their therapist, the information, and also the next page is information that, or they also provide separate information to the patient. So oftentimes they will send an email to the patient that gives them directions on how to best optimize their situation getting telehealth. The important thing is that you want to be able to hear and see your patient properly. So make sure your speaker and your volume is adequate for you. And then also ask your patient, can you hear me? You might make suggestions on adjusting their volume or maybe even putting earbuds in so that they can hear you better. They should be in a quiet environment without a lot of distractions, maybe having the door closed to whatever room they're in. You will also be in a quiet, private environment. You don't want other patients or therapists in the background. You don't want to see people walking in their background, and they don't want to see people walking behind you in your background, because then that means that their private information is being compromised. It's important when you're looking at the camera, or that when you're looking at when you're doing your interview, you look at the camera of the computer and not just the picture of your patient. Because when you look at the picture of the patient, it really doesn't feel like you're looking at them. And so it provides an added personal touch when you're looking at the camera and the patient feels like you're looking at them. It makes the experience a little bit better for the patient. Remember that unlike in a face-to-face discussion, the webcam naturally has a limited line of sight, so that if you have to go and grab something from, a document or a piece of equipment, please explain to your patient what you're doing so that they understand that you haven't left the room, you're not going to forget about them. If you're taking notes, make sure you let them know that you're going to be typing so that they understand that if you look distracted, it's really because you're trying to provide your best patient care and you have to type some of this information up. I apologize that this page 2 is sideways, but basically, again, we want to make sure that our background is simple, avoid clutter. You don't want things that would distract your patient. Check the camera focus in your seating position. You want to be close enough to the computer, but not so close that, it's overly distracting that, we're staring more at your right eye than the left eye, or you're super close. That might be overly distracting. Make sure the lighting is in front of you and not necessarily overhead. Overhead lighting is fine. Just make sure it's not casting super weird shadows on your face. But lighting coming from behind can be very distracting because it may look more like a glare. And then what happens is your face is going to be dark compared to that bright light. Control that background noise and keep privacy. So make sure you're in a quiet, private place with the door closed. So I'm going to show you this video. And like I said, I'm not going to show you the whole video, but I want to highlight some of the things that I was just talking about in this video.
All right. Good afternoon, Mr. Menzies. Good to see you again. My name is Joseph. I'm a physical therapist. I understand that you had an evaluation for your right ankle. Is that correct?
Yes, that's correct.
Perfect. And before we move on, can you just confirm, your first, last name, date of birth for me?
Catherine Amenti, and date of birth 7/19/71.
All right, great. You're my person. How has your right ankle been feeling since the initial evaluation that you had?
It still feels stiff. I think it doesn't bother me as much at night, but it still feels stiff. So if I pull the toe,
just going to be important for later on as we kind of get to see some of your movements and stuff. While we're chatting back and forth, I'm going to be just taking some notes. So if it looks like I'm not paying attention to you for whatever reason, I'm documenting some of today's findings. Okay.
Okay.
Yeah. So again, would you kind of start over and just let me know again how you've been since the first session? How's the right ankle, and how do you feel today?
So I'm pausing it. I'm letting you know, reminding you that I am going to skip through the video some, just so you don't have to hear the entire thing. Remember that at the very beginning, he introduced himself and he clarified that he is speaking to the correct patient. So you don't want to be in a situation where you're talking to someone and maybe they were just getting it set up for someone else, and then you start divulging private information about the patient to the wrong person. So make sure you're speaking to your patient. And I'm sure you've had this information already. Oftentimes getting the name and date of birth helps you clarify and make sure that compares with your notes of the patient that you're supposed to be treating. And then he also explained his communication and that he'll probably be typing. And so I'm going to skip over the subjective part, but you can definitely listen to the subjective information on your own.
Rate any pain or discomfort.
And then when I'm at rest.
From the last note that you were having some trouble with that.
Barefoot, and then I'm barefoot. It feels a little bit tight.
I would like to see how you're moving today a little bit and get to take a look at the ankle. Obviously, I can't touch and feel on there, so I'm going to help guide you into showing me where some of the painful areas still are, so I can just get a better idea about how to help you in today's session, if that's okay.
Okay.
Excellent. Are you on a computer, tablet, or phone right now?
I'm on a tablet.
On a tablet? Great. Is it possible to place that tablet on the floor so I can get like a side profile of your ankle?
Yeah, I think so. Hold on one sec. Is that better now?
Great. So yeah, that's definitely the level of what I'll need. However, I can only see from about your knees on up. Is there any way to maybe adjust and prop the tablet up so I can see your ankles?
Let me see.
That's the perfect angle right there.
Okay. Hold on. I'm getting ready for a camping trip. Testing out my new sleep system.
Hopefully we can get your ankles ready for that trip.
Exactly.
Now you can see there's a difference in the environment where the patient was having looked like in a relatively quiet environment. And now you see the patient has like a lot of stuff around, possibly has enough room for the activities that the therapist is going to ask her to do. But that's something to keep in mind as you have your patient move around. You're going to look for, areas that look maybe like they might not be safe to perform things, or where they're going to be more safe to perform things. And you'll hear him discuss that in just a moment.
Well, I can see that you're standing pretty well. You're kind of favoring to the left side, it looks like, from this side?
Maybe.
Yeah, I see a little bit of that, not too much. Would you be able to just shift your weight side to side from the right to the left? Let me know if that feels any pain at all.
Yes.
Gotcha. And then on the outside of the ankle as well?
Yeah, a little bit back here, mostly in the front.
Okay. If it's all right with you, while you're there, could I see you, to the best of your ability, do a squat and try to touch the floor? Okay. And
not my easiest thing to do.
Does that hurt your ankle at all?
No.
Good. That's really good. Last session that seemed to hurt, so I'm glad there's some improvement with that. I'd like to test your balance now on that ankle, because that'll be pretty important, particularly for your upcoming trip. Is there anything that you could hold on to that's pretty sturdy? Maybe like a countertop or a dresser?
Yep. Excellent.
Could I see you place your left foot in front of your right foot, touching the toes to the heel? Kind of another 5-10 seconds. Just a good indication of good balance. All right, great. Carefully, just keep holding on to that countertop. and then switch your foot position. Oh, a friend came.
Perfect timing.
Wait, you didn't fall over and your balance is good, so.
So that's a reminder that things can happen during treatment. Could be a cat, could be a dog, could be a kid. So, you may have to be a little bit patient with your patient, but hopefully they knew in advance to not to kind of minimize the odds of those things happening.
Get back up there. Up. Okay, go to your place. There you go. All right, sorry about that.
Okay. Was there any pain in the right ankle with that at all?
No.
Great, excellent. The balance looks really good. Keep holding on to that countertop. I'd like to see you actually balance on your left leg. A little bit more motion there on the right. Any pain at all?
No. It just feels a little tight, but it doesn't hurt. That hurt.
With bringing the leg out to the side?
Well, the leg out to the side because my ankle started going, kind of turning out.
Gotcha. Okay. And you can put that down. Overall, with the hand support, that was pretty good. Swelling whatsoever.
Going right here. Mm-hmm. But this isn't really where it hurts. It hurts more in here. And that does seem to be maybe a little bit puffy, but this side, there's always like a little pocket of fluid right there.
Was that with the squatting and the walking that you feel that?
Yeah, this side right here.
Okay.
On that bump.
Okay. Great. And you don't feel that on the left side, correct?
No.
Good. Could I see the left side, please?
Yeah.
Yeah. Okay. I see what you're talking about. Grossly, again, it's hard to get a good estimation of there, but visually it does look like, yes, there might be a little bit more swelling around that same joint that you're talking about.
Okay.
All right, great. I'd like to take a look at your range of motion. Is it possible to put a chair right in front of the camera where you're at right now?
Yeah.
Great. Great. A little too close to the camera. Would you be able to move the camera back? I'm sorry, move yourself back.
Actually, let me try this.
Oh, works right.
Is that better?
Yes, I think it's back some, but yes, it is much better than what it was.
Okay.
Perfect. So I'd first like to see you with the feet, just lift them up and down like so, both at the same time.
Like this?
Yes. Does that hurt at all?
Yeah, it feels.
Now you'll see that he used his wrists to mimic the dorsiflexion, plantar flexion action. The patient did plantar flexion instead of dorsiflexion. So he's going to gather that information and then he'll ask her to do the dorsiflexion afterwards. So just remember that instead of moving your camera to show your feet, you might be able to get away with using a hand signal or some kind of an other signal to indicate what type of movement that you want. If that doesn't work for your patient, then you may have to actually back up, stand up, and get your own camera positioned so that they can see what movement you actually need.
A little bit sharp over here.
On that side? Okay.
Mm-hmm.
Now what about lifting the toes up in that same position? Good. Are you able to lift the entire foot up in that position?
I can if I go out here.
Okay. Go up.
But not if they're underneath me, barely.
Go up as high as you can on both. Okay, so it still looks like there's some limitation there on the right side, correct?
Like that?
That works great. Okay. So what I'd like to see you do here is with the left foot, bring it in towards the right. Okay, and separate them again as best as you can without moving your knee. Good.
Yeah, that same tendon area a little bit.
Okay. Now I'd like to go in the opposite direction. Let's start with the left and then bring it back in.
It feels fine.
Okay. So mainly it was just the going in while, so a couple things. It looks like that the range of motion is still a little bit affected. Okay. So I'll guide you through a stretch here to kind of be more specific than what we had on the previous session to kind of help assist with that.
Okay.
I think it would be a great idea to continue with some of the range of motion exercises since they've been helping up to this point, and it seems like only one of the 4 major motions of the foot and the ankle seems to bother you right now, as opposed to last time it was all 4. So I think that's really good improvement.
Mm-hmm.
The amount of swelling still there. Gentle motion every hour, maybe about 10 repetitions in every direction is going to be very helpful to continue getting that swelling down. But then at the same time, we also want you to continue icing as well.
Okay.
Yeah.
So that was a little section of patient education, reminding her to do her home exercise program, getting ready. So you see all of this so far in the video has really been subjective and some objective information, mostly because he hasn't seen this patient before. And now he's going to do treatments and just a couple of things.
You can pan up so I can see your face. Great. There you are.
Hold on. Here we go.
Great. Do you have any equipment that was provided to you on the first session to be able to stretch with, or no?
I have a dog leash to use for my seated stretch.
Okay, great. Yeah, if you could grab that, I'll walk you through that one stretch, please.
Okay.
Excellent. Oh, that works perfect. It looks there. All right. You're going to pull up on the front of the foot by where the toes are to help bring your front of your foot and your toes closer to your face.
Okay.
Would you be able to pan the camera down just to make sure you're doing it correctly?
Mm-hmm.
That should work right there. Good. Feel the stretch down closer to the yourself some rest in between just to kind of move it around and let the stretch go and get some circulation back in the ankle. Yeah, great. Looks really good. Off with doing some balance exercises since we saw that the right side still was a little bit more shaky than the left. And I'll go through those if you can pan the camera over back to that counter you were standing at.
Yep.
And yeah, the counter is a much better idea. Just in the off chance that you lose your balance, that's a little bit more stable than, let's say, trying to hold on to the chair you were using.
Okay.
So since it didn't hurt, you can lift your left leg up about to the hip height. Bring the knee up. Very good. And without touching the feet or the legs together, you're just going to hold that position about 20 seconds. And that'll help work on the balance of that leg. You should be feeling the muscles even up the leg all the way up to the hip working a little bit more.
Yeah.
No pain, correct?
No.
Okay. Those are the big things that I think were needed right now. You're still only pretty well in the acute phase, so some of that swelling and some pain with some movements is to be expected still. However, I do think it's a good opportunity in time now to start progressing some of these things since they don't seem to be bothering you a little bit.
Okay.
All right. Any questions for me at all?
No, I don't think so. I think, yeah, no, I don't think I have any questions.
All right. Well, if that's all for today, I'm going to go ahead and finish up typing these notes. It looks like you're coming along just fine with the plan of care that they've set out for you on the first visit. We'll check back in about a week just to ensure things are keeping up, and then I'll give you some more guidance from there as to what you can do and progress to.
Okay, great.
All right. Have a great rest of your day, and then we'll talk soon.
Thank you so much.
Okay. Back to here. Okay, so let's move on. The considerations that I want you to think about when you're treating the elbow and wrist. So you just went over elbow and wrist. You should have in ortho. I want you to continue thinking about how high of a risk these muscles are in. They're at risk of injury in our overly typing device holding society. So think about how often you're sustaining a grip holding your phone, whenever you are on the computer, how much motion is happening at your fingers, and think about how much forces are actually going through your fingertips as you type. Posture is always going to be important when we're addressing the elbow and wrist, especially if there's numbness and tingling present. Remember that numbness and tingling could be coming from an entrapment of a nerve anywhere along the nerve fiber or even up as far as the cervical spine. When you're palpating the extensor muscles and the flexor muscles, remember that when you're around the proximal flexor muscles, the ulnar nerve is diving in there. And so you want to make sure that you're not compressing on the ulnar nerve when you're doing your soft tissue work. And there, again, here are a couple of videos from the massage therapist who does the nice painting and active origin and insertion information. However, we also have our body regions for surface palpation. So if we look at the elbow or the wrist and hand, we're going to have bony palpation with a list of our carpals, soft tissue, and our nerves. So definitely make sure you go through that with the elbow. You're also going to see bony landmarks, soft tissue landmarks, and again, looking at where the nerves are commonly getting entrapment. That's going to be really useful information, especially when you get out to the clinic. Okay. Look over these exercises once again, just like you did in the last video. I want you to think about what exercises look like they could be beginner exercises and what exercises look like they could be more advanced. When you're stretching muscles, remember where their origin and insertion are. So for some forearm stretching, having the elbow straight will provide the maximum amount of stretch, whereas some of the muscle fibers may not cross the elbow joint, and having the elbow slightly flexed will favor those muscles. Triceps and biceps stretching. So there's some additional ways of stretching those muscles. Things to consider for the wrist and hand. Remember, you've got all those flexor tendons going through the carpal tunnel with the median nerve. So if you have any median nerve entrapment issues, oftentimes we will give tendon gliding as an exercise. So the starting position is in the middle, and you can move in and out of these other positions to get the superficial flexors, superficialis, to glide over the deeper flexors, and also kind of massaging the median nerve within the carpal tunnel. Putty exercises are going to be very more specific to the hand as far as intrinsic muscles and those gross motor flexor, wrist and finger flexors and extensors. Towel exercises, for remember in that video we just watched, he asked the patient if she had something that she could utilize for exercise at home. She had a dog leash. So the dog leash was very handy for helping to stretch the ankle. We can also utilize a towel or a washcloth for gripping activities and pinching activities. If you add water to that towel and hold to the heavier, it's going to be heavier. You hold that over the sink and now you've got the force that's required to wring it out. Be careful about having someone with an acute wrist injury do towel wringing with actual water in the towel, because there's a lot more force involved and that may aggravate their symptoms. So again, think about which of these exercises look like they are beginner exercises, entry level, if you will, and which looks more advanced and why. Because again, you may have to, if your patient is experiencing pain during an exercise that you thought was amazing, you're going to have to figure out on the spot how to make that easier, to modify it to make it easier, or modify it if it's not a problem and you want to make it a little bit more challenging. We will go through these case studies in class, but please take a chance to look them over before class. And we'll see you in class. Have a great day.